we have with us Mr. Bar Binas, who has come all the way from Israel, Tel Aviv, and he has come to India for his limb lengthening surgery.
I knew about this surgery about 3-4 years ago already, and how to do the physiotherapy by myself, and I felt more comfortable actually looking into it more and actually checking how it works. And I spent around 1 month all day on my computer, just looking for the places 24/7.
Average height in your country, what is the average height in your country? You have an idea?
Height in my country is about my height.
About what aspects, specifically if we compare both the countries, you must have experienced something that why India is more comfortable, because you have not, I believe you have not visited India earlier.
And I felt that India would be a bit more safe for me at least.
Hi everybody, this is Dushyant from MedSurge India, and today we have with us Mr. Bar Binas, who has come all the way from Israel, Tel Aviv. He's 23 years old and a fitness trainer, and he has come to India for his limb lengthening surgery. So basically in this podcast, we'd like to hear about his experience in India and overall experience with this surgery. So welcome Mr. Bar Binas.
Welcome.
Yes, so we'll be exchanging some questions with you and would like to hear your experience. What motivated you to consider limb lengthening surgery? This is a very important question. I know you must have also given a lot of thought about it. Yeah. Yes, over to you.
Well, I have been thinking about it for the last few years, I guess. But as time progressed, I had maybe other goals in life before a couple of years. But once I realized that the most important thing for me is maybe my posture and how it can help me to introduce myself to other people, and how I walk around the world and feel confident. I think that's the thing that really motivates me to do this, because I wanted to feel like I'm a bit more than maybe average height. I wanted to stand out a bit more, even in maybe Western countries. So that was my main motivation, to really make myself stand out and feel more confident and be a better self, a better version of myself.
What is the average height in your country? You have an idea?
Yeah, the average height in my country is about my height, about 176 centimeters. So I'm about my average height in my country.
So moving on to the next question, why did you choose India for your treatment?
Mm-hmm. Well, at first, obviously, I wanted to do a research about what countries are maybe doing this surgery more often. And I felt like that India was the best option for me, both in the reviews I got from other people, and both from the aspect of where I probably will feel comfortable to go.
So was Turkey in your mind?
Yeah, exactly. Turkey was the second country for me to think about. But in the end, I found India to be a bit more comfortable for me to go to.
So any specific reason why? I mean, of course, people who are watching this, they would also like to know what aspects, specifically if we compare both the countries, you must have experienced something that why India is more comfortable, because you have not, I believe you have not visited India earlier.
Yeah.
So before visiting here and not knowing about not knowing India as a first-hand experience, mm-hmm. So you must have had discussions even with somebody in Turkey. So what made you decide comparing both the discussions?
Yeah. I think the idea that in Turkey the time right now is a bit more sketchy a little bit, and I felt that India would be a bit more safe for me at least. And also, just when I talked with Sarita, she really helped me to feel like things are going more smoothly and faster, and everything is more, I can understand more how the stuff will work, and it felt more clear to me. And therefore, I also talked with some company from Turkey. I also took it into consideration, but just doing it with this company made it easier choice for me.
How easy was it for you to reach to India considering options like, applying for visa and other formalities, and of course the role of our company MedSurge India.
Yeah. So at first I was a bit worried because I didn't know how this kind of stuff work. I never did surgery in other country, obviously. But once I talked with Sarita from the MedSurge company, she really helped me to understand how to do it, and I realized that it is more simple than I even thought it is. All I had to do was just go on the internet and fill a e-visa application, and she helped me through it all with very quick answers to what to fill and how to do it. And once I had the application sent, I got it within a few days, and everything was fine. It was very easy, very simple. Yeah.
Most of the countries now been given e-visas for India, whether it is a medical visa or a tourist visa, and e-visas are granted within 24 hours to 48 hours maximum. And those countries where there is no option for e-visa, of course, in that case, patients, they have to visit the Indian embassy directly. So now we are moving on to the next section, which is the experience with the surgery and overall experience with the hospital staff and everything.
Yeah.
So can you walk us through the whole surgery process? How was it like for you?
Well, on the first day that I arrived in India, I had someone from the company obviously taking me straight from the airport into the hospital to do all the first checkups, test the blood and all the things that are important to do before a surgery, and fill up all the paper that needed. And also I had at the same day a meeting with the doctor already. He met with me and asked me what are my goals face to face, to really see how my legs can stretch and stuff like that, and if it's possible to reach my goals. So we had a nice talk and he explained everything to me. And after that, it was just a matter of days until scheduling the actual surgery. I spent 2 or 3 days, something like that, in a hotel, and until I had to go to the hospital already to do my surgery, which was really good because everything was going really fast and there was almost no delays, and it made my time here better because I wanted to get it done faster. Yeah.
Okay, and another important point is before he arrived here, we also arranged one video consultation with the same doctor who performed surgery here. So how was your experience with the doctor, his medical team, the nursing staff, and of course the facilities at the hospital?
So once I arrived at the hospital, I was very impressed with the look of the hospital. It looked pretty advanced to me. Everything looked fine. Everything looked very clean and taken care of. The doctor gave me the attention that I needed. He answered all my questions, and while I made it to the hospital to do the surgery, the pre-surgery and post-surgery, they treated me very well. Every nurse and every staff in the hospital was very quick to help me in everything I needed. And even when it comes to food, they prepared me any food that I asked them to, with any request that I had, because I had some special requests for food, and they actually did it, and I was very surprised at how much details they put into everything.
So what all physical therapy and exercises you are doing in this recovery process?
Well, when I was in the hospital post-surgery, they already appointed me some people to help me with physiotherapy, to explain to me what to do once I'll get to my accommodation, once I get to my hotel, and how to do the physiotherapy by myself and what to do to strengthen myself. Obviously, as a fitness trainer myself, I didn't need much help about how to strengthen myself because I already knew what to do. I bought myself even lifts to have weights to have at home to lift them and to keep myself strong, because obviously you'll need to move yourself from your wheelchair and stuff like that, and you want to keep yourself strong enough to do it. In terms of physiotherapy, the company also appoint you a physiotherapist to help you, and you can schedule him whenever you feel like. But again, I had a lot of experience with physiotherapy myself because of an injury that I had in the past in my knee. So I felt like I don't need many meetings with the physiotherapist. Of course, I will recommend to anyone who come to do the surgery to have the physiotherapist with him all the way through, and even after they finish the surgery. I myself, because of the experience I had with physiotherapy and all the experience I have with being a trainer, I knew how to manipulate my body and work with it and do the physiotherapy. But it's very important to put a lot of emphasis on it and to really take the help that like they give you.
And how soon after the surgery did you start noticing changes in your height?
Well, I think because of my legs and especially tibia and calves area are very skinny genetically, it took me a little bit of time to realize that I'm getting taller and longer in my legs. But probably after 2.5 centimeters, that's when I started to notice like my legs getting a bit longer. I even asked my caretaker about his perspective to tell me if you see any different, and he told me that he does see that my legs are getting longer. So yeah, about 2.5 centimeters, that's the point that you really start to see the actual change in your length of the legs. Yeah.
Okay, and we have forgotten one more important point to be mentioned, the kind of surgery he has undergone. So we must also focus upon, you have taken LON method and via tibia route.
Yeah.
Okay, so any specific reason you chose this and not the other way?
Well, the LON is mainly because it has some pros and some cons to do it, like compared to other methods maybe. But again, basically the price was just right for me to do it with the loan method, and it's a pretty reliable method to do. A lot of people choose this method. And also I decided to do it in my tibia compared to my femur because I felt like I don't need the maximum height that maybe you can gain from doing it in the femur, and also from a proportion kind of look. I felt like my tibia could get the length better in my overall look and proportions, and I felt more comfortable to do it in my tibia. Yeah.
So that is very important to know for the prospective patients, because some of the patients, they start becoming greedy. So they say that we'll get it done in both the sides with tibia and femur both, without understanding the structure of their body.
Yeah.
So sometime, they don't understand what lies for them ahead. How much recovery time will it take if they undergo both the process? So ultimately, you have to see your body structure and also try to focus what their treating doctor is saying, because doctor also knows about their structure. So sometime, the doctor recommends for some patients to undergo via femur route as well. So of course it is the perspective of the patient, but it is crucial. So what kind of dreams were you getting? Or like you were getting dreams to, because in dream you might be thinking, I'll start walking. You have the implant placed here, but sometime, in the morning when you get up, how was it like that you cannot walk for few days? And how do you deal with it?
It's actually a good way to give your body a little bit of rest from you walk all your life, you're on your legs all your life. It's a bit of like giving yourself a bit time to rest. And if you are in the right mentally thinking about it like that, then it will be easier for you. You don't really need to think about, oh, I can't walk. You need to think about, okay, that's a good time to let my body rest and go through it. And in the end, I will achieve something great.
So occupying yourself for almost 3 months, what kind of activities you are doing in your apartment to keep yourself busy?
Yeah. So obviously, maybe the loneliness is really the hardest part. So obviously, if someone can bring someone with them to accompany them, that will be better. If they can do it maybe with other person together, or they can be in a place that they can meet another person who go through this kind of surgery as well, it can be better for them because then they can entertain each other. For myself, I choose to open a YouTube channel to record my journey, and that really helped me to interact with other people around the world, and that way I can spend time actually helping other people, and also finding some pleasure in maybe enjoying food, because in India you have a lot of different kind of food that you can enjoy, and maybe cooking a little bit, also training, doing physiotherapy. So I do find myself doing stuff most of the day. And also finding some games, if you like some console game or game on your laptop or on your phone, that also can help you go through some of the time of the day. And once you have some schedule of the day that you go through, and after every 6 hours you obviously need to lengthen your legs. So once you have a proper schedule, the day can go faster.
And what would you suggest to the prospective patient? What kind of accommodation they should choose? Because they'll be spending majority of the time in the apartment and managing your daily task. When you have your daily task to be performed in whatever condition you are. So how do you deal with it?
First of all, I would recommend to everyone that's gonna do it in India to find a place that they will feel that they can be mobile in. That's the most important thing, because you don't want to just be in bed most of the time. You do want to move a little bit inside your room and inside your house. So find the right place for you to think what are the things that are important for you. Maybe to have a balcony, maybe to have a place that you can go outside, maybe a rooftop that you can interact with other people. And you just learn through the way how to do your basic stuff, and you learn how to like use your body, and it's getting easier through time. You're getting like more comfortable with your legs, and things get really easier once you learn how to manipulate your body to do everything.
So the role of accommodation is very critical, as he's suggesting finding a comfortable place rather than focusing. I would suggest, rather than focusing upon a budget, one should focus upon a comfort of that place, because they'll be spending majority of the time. So for the follow-up and checkup, what was the process, how long it was, and how frequent?
That's something that is like decided by the doctor. He tells you when is the next checkup. Obviously, right after the surgery, the checkups are more often, and they happen around every couple of days to a week. But then it becomes like about a week and a half, maybe 2 weeks towards the end. And maybe in the end of the lengthening, you do go more frequent again, because you want to be precise at how much you lengthen and how you feel, and it become a bit more complicated. Maybe in the end, more challenging. So yeah, the checks up, you just take usually like a cab or a taxi. You can even take an ambulance if you feel like it's more comfortable for you. You do an x-ray, you meet with the doctor, he tells you how much you length, how do you feel about it, maybe if you change your goal, or we are in the same goal as we were before. And according to that, you decide what to do next. Yeah.
And within this whole process, our teammate, the operational team, they are always available, and they are in touch with him and as well as with the doctor. So we are always with him whenever he's going for his follow-ups. So moving on to the next question, how was your experience with MedSurge India assistance part at each step?
Yeah, so my experience was very helpful and very quick all the time. In anything that I needed, the coordinate helped me right from the first moment, from taking me obviously from the airport, and then helping me through all this time, all these 3 months, helping me in whatever thing I need. If I had to go to do checkup in the hospital, he came and helped me alongside my caretaker that was also appointed to me through the company. And the caretaker was great. He really helped me in everything. And also I had a wheelchair that the company also helped me to get, that will fit my needs. So yeah, I would really recommend it for anyone, because it's really simple and it's really helpful. Yeah.
Yeah, that's very important. Being a facilitating company, our job is to offer the best of the costings available in whole of the country, the best of the doctors who are performing this kind of a surgery or any kind of procedure they are looking at. So we try to get you a kind of a tailor-made package for you, so that you can choose which suits your budget and accordingly choose. What kind of advice would you give to the prospective, I would not call them a patient, prospective people who are looking for a limb lengthening procedure?
I will give them the advice to really look into it, do the research, not just going to anyone that they feel the prices just fit them. Also to actually check, like I did with MedSurge company, and to check about the doctor, to see all the details, to ask for reviews like I did, and I got the reviews that I needed. To really look into that, because it's not a simple surgery, and also to think if they are really prepared for it, for all the cost and all the things that come with it. if they are mentally prepared for it. And if they do, obviously, I will recommend to do it in India if that fits all their other aspects. Yeah, I think that if the person feel like he really wants to do it, I will recommend doing it because it can really help them later in life, and it's a small sacrifice for a better future.
So, as per your experience, what is the most rewarding part in the whole journey?
The most rewarding part is the actual achievement of each centimeter that you get, the feeling that you're getting closer to your goal and actually reaching your goal at the end, hopefully. That's the most really pleasure part of this whole thing. Obviously, it's not easy. It's not a walk in the park, this kind of surgery. It is very serious surgery to do. But the outcome and what you get in the end really worth it. So really the end goal is what really motivates you and what really the biggest feeling of achievement that you can get from this.
So I think maybe we can also explain the viewers about this fixator, because these fixators are supposed to be removed. I think maybe in next week we're removing it. So how are you dealing with it, and what do you do with this fixator on a daily basis?
I need to do some cleanings around the area of the wounds, around the area of the pins, to keep myself safe from any infection. And the doctor explained to you how to do it. All the nurses help you also to understand how to do it. And you do it about a day, about daily, maybe 2 days, something like. Depends on how do you feel to keep it safe. Also, you have a nail that they provide you to make it the fixator loose, and then you can lengthen and close it to make it safe and stay in place. And basically every 6 hours you get about a 1/4 millimeter taller, which adds up to 1 millimeter a day. So about 60-70 days, it's like what you need for like 6 centimeters. It's very simple. You don't feel any pain while doing the lengthening, the fixator. You don't really feel them. They wait a little bit, but you don't feel like they are there. Obviously, you need to adjust yourself sleeping position wise and stuff like that. Depends if you do it in the tibia or the femur. You need to sleep differently. But you don't really feel them going through you. You feel like they are there, but it's not a big issue in everyday moving and mobility.
So how was it like the initial few days when you were with the fixator? Like the initial 15 days, were they tough?
I guess the first few days were a little bit harder, but the hospital helped me with epidural and other painkillers to help me go through those first challenging few days. After that, it gets easier every day. You feel it less and less every day, and you get more used to it. And probably by the time they get removed, you're probably gonna feel a big relief.
So like what is your life after the full recovery and height gain?
I will feel very confident to walk around with even the most flat shoes, which is something that I really wanted for myself, because in the last 3 years, since very caring about my height, I started wearing maybe shoe with lift or shoe that makes me feel a bit taller. And now when I will have it very naturally, I will have one less worry in my life. I will be able to wear whatever I want. I will be able to maybe get better treatment from people, even better than before. So I think it will affect a lot of aspects in my life, and especially how I feel and how I walk around with more confident and show more confident even in my walking and how people receive me. Yeah.
I think the most important question is how much height you have gained up till now, and what more we are expecting out of it.
Yeah, I gained around 5.5 centimeters until now. So I have about 5 days until the next meeting in the hospital, the next checkup. And then I'll probably reach my goal, which was 6 centimeters. It's a pretty ambitious goal for the tibia. Usually they will recommend you to gain 5. But again, it depends on how you feel at the end. And if you feel like you can do it, you probably can tell, because if you feel like you can't do it anymore, then you won't be able to endure it. But I feel like I can endure it and I can reach my goal, and my doctor also approved it. So I'm very hopeful and very happy that I'm getting very close to it, and I believe that it's right. The finish line is right there. Yeah.
So great to hear that. And of course, what would be your when you go back home? What would be the other family members' reaction would be?
I think it will be very interesting to see. I'll probably be taller than what my father was when he was my age, and I'll probably be taller than my brother, who exceeded me by a centimeter or two. Now I'll be taller than him again. I think it'll be interesting to see who will like be able to tell the difference. Maybe some people will, maybe some people won't. I want to be hiding it. I think that the more outgoing you about it and more honest about it, the more people will be able to understand it. So I think the people will just, once they see you fully fit, fully able to walk again, they understand that it's not such a big deal, and it's actually gave you some advantage in life. And they will be happy for you in the end, because they will see that you are more happy, more confident.
So I think exciting time lies ahead for you.
Yeah.
And I wish you all the best. And we really thank you for trusting us, for trusting India, and overall the hospitals here and doctors here in India. Yeah, so this was Mr. Bar Binas, who shared his experience and his journey with limb lengthening procedure. And I hope all of you who have watched this series and those people who are looking to undergo this cosmetic procedure, they can of course get in touch with us, and we are here to answer all your queries. Thank you once again, Mr. Bar, and we wish you the best.
Thank you very much.